The route of drug administration. Introduction. Drug administration means the flow of drugs into the body. Two main routes encompass enteral, which is the administration of drugs orally. Concurrently, parenteral entails piercing the skin. Enteral is the simplest mode of administration, involving swallowing or placing drugs underneath the tongue. Oral delivery of drugs to the stomach occurs after swallowing, whereas putting drugs under the tongue allows direct assimilation into the fluids. Dosage types taken orally comprise solutions and solids. Body. Before administering drugs orally, important issues must be considered. The condition of the patient, which influences the capacity to take drugs, is paramount. Drug ingestion requires that patients retain the drug after intake. Furthermore, the drug ought to be present in the gastrointestinal tract. Any condition that hinders this has to be addressed. It is vital to consider the patient's gastric emptying interval, provision availability, and intestinal or gastric pH. Variations in any of these factors affect the movement and strength of drugs, thus lowering their effectiveness. Before administering the drug orally, it is rational to carry out patient education to determine whether the patient can endure taking the drug orally. Patients may lack the capacity to take something via the mouth. For example, when a patient is vomiting or unconscious, he may not take anything. In this case, a decision to use other routes of medicine administration is paramount. There are certain cases when it is irrational to administer drugs orally. For example, when patient education reveals a condition that hinders oral intake of drugs, then it necessitates the use of other routes. The advantages of administering drugs orally lie in their simplicity and convenience. The patient does it alone, so specialized paraphernalia or instruction is not required. Most patients accept drugs administered orally because they consume minimal time. Drug administration via the mouth has its negatives, as manifest in factors that can hinder absorption. Some patients encounter concerns swallowing the prescribed amount of drugs. Such techniques pose management troubles amongst elderly patients. Intestinal fluids pH also reduces the effectiveness of the drug. The existence or deficiency of food in the body affects the drugs. For example, food reduces the rate of incorporation. The occurrence of alcohol also hinders absorption as it slows down food movement. These drugs are subject to destruction by gastric acids or enzymes. Furthermore, other drugs may not be absorbed. The slow movement of food in the intestines, where drug assimilation occurs, makes the dissolution and absorption process difficult. This is frequent with medicine that is enteric-coated. Medical practitioners sometimes find it necessary to use this method of drug administration. This situation is always actual because this is the simplest, standard, and convenient drug administration method. Apart from this, practitioners also use this method when the patient's health condition allows it. Conclusion. From the above discussions, it is clear to note that oral administration of drugs remains an elementary technique. The method requires that the patient's condition sustain the intake of substances. The method has several realistic advantages over thus making it a preferred way of issuing drugs. The disadvantages are also worrying, since the speed of dissolution and absorption may be too low. Many people choose to administer drugs orally since it eliminates the need for hospitals.